Multiple studies show people who've contracted COVID-19 may be at a greater risk for developing type 2 diabetes. Tonight, doctors explain that more research still needs to be done to understand why.
In scientific terms, what we usually say is that we have shown an association, we have not shown any causation, right? Like, so this is something that we are seeing that it kind of goes hand in hand, but we are not seeing, or we cannot prove right now that this is the cause of diabetes itself.
Dr. Dougal says they also have to consider the possibility that these people were already at greater risk for developing diabetes and the virus simply unmasked it. Another factor could be that more cases of diabetes are being reported now since long haulers are being more closely monitored by their physicians. With that being said, if you suspect you may have diabetes after contracting COVID, there are certain symptoms to look out for, like being very thirsty and hungry, having frequent urination, experiencing numbness in hands and feet, and losing weight without trying. Dr. Dougal says in order to prevent these kinds of COVID-related issues, it's important to make sure you are vaccinated and boosted.
We're seeing a lot of consequences in terms of long COVID, in terms of other factors. So absolutely, vaccinations, boosters, and prevention remain the bedrocks for our fight against COVID.
Dr. Dougal says it's difficult to say whether people who had COVID and developed diabetes will have to deal with it long term or if it could just be temporary. He says more research needs to be done in that area.